So why are so many young kids getting braces these days?
Our national association, the Association of Orthodontists, recommends that children be screened by an orthodontist at age 7. At that particular time, the permanent incisor teeth and the molars are erupting, and we have an opportunity to assess many things. There are occasions when we've seen children at an earlier age for birth defects or severe underbites, even at the age of 3 or 4. At age 7, the permanent incisor and molar teeth are erupting, and it gives us an opportunity to make 2 assessments. Number 1, do we have enough room in the mouth for all of the permanent teeth? Yes or no. And are the jaws the same length and the same width? Yes or no. If they are, it gives us an opportunity to reassure the parents that teeth are erupting well and that there may be some orthodontic issues that need to be treated as a teenager, and to give them an opportunity to prepare financially for that treatment. On the other hand, if there is an insufficient amount of room in the mouth for the teeth, or there's a difference between the upper and lower jaws, it gives us an opportunity to treat those problems and to intercept them at an early age when there's an active period of growth and development occurring, and there's an extreme amount of cooperation, and to treat those issues so that they don't become bigger issues as a teenager. It also many times minimizes some of the self-esteem issues that some children have in their adolescence.
Are permanent tooth extractions still necessary?
Well, there's no doubt that there's a huge trend in reducing the number of extractions of permanent teeth compared to years ago. There are 2 factors basically that determine the recommendation to remove permanent teeth. First, do we have enough room in the mouth for all the permanent teeth, and can they be well aligned in such a manner as to create a healthy amount of gum tissue and bone around those teeth for the lifetime of the patient? Or is it possible, many times through early interceptive treatment, to create more space for those teeth? And secondly, we have to look at the patient's facial aesthetics and determine their profile and their lip support and make a decision: would the removal of permanent teeth enhance the facial aesthetics and the facial profile, or would it detract from it? So as you see, each decision about the removal of permanent teeth is made on an individual basis.
How long does treatment take?
Well, there's no doubt that treatment is a lot shorter today than it used to be because of all the advances in technology and new appliances that reduce the treatment time. Generally, the length of treatment is much shorter today than it was many years ago. The reason for that is there are several advances in the types of braces that we use and the methods that we use. Along with that, we're using a much more flexible wire made out of titanium that allows the treatment to proceed at a faster pace and at a more comfortable rate. But generally, the treatment plans that used to take us 2 to 2.5 years to complete can many times be completed in a 15 to 18-month treatment plan.
Why do some children have to wear braces more than once?
Great question. That just means our message is finally getting out. Many times children need early interceptive treatment. And the reason is that they don't have enough room in their mouth for all of their permanent teeth, or there's a discrepancy between the upper jaw and the lower jaw. And it gives us many times an opportunity to deal with those problems and to intercept and hopefully prevent bigger problems from occurring as a teenager. The second time that you see children wear braces are after, many times in their teenage years, after all of the permanent teeth have erupted. We'll put braces on all of the upper and lower teeth in order to idealize the alignment of the teeth and to correct the way that the teeth fit together, or to correct the bite. So we'll do some braces during the early phase of treatment in the interceptive mode, and then the comprehensive mode as a teenager.
So will you be cleaning my children's teeth during treatment?
We will go over many instructions on how to care for the teeth and maintain them after the braces go on, what appliances to use and how to use them. You will need to maintain, it is imperative that you maintain your regular scheduled visits with your dentist for cleanings. Your dentist may increase the frequency of those cleanings during the time that you're in orthodontic treatment.
I never heard of jaw surgery when I was growing up. Why are so many patients getting it now?
Many patients present for treatment with complex bite and alignment issues. Many of our adult patients that seek treatment have sometimes complex malocclusions or crooked teeth, and many times that can't be solved just by rearranging the teeth. And that's due to the fact that the upper and lower jaws don't fit together. And at that point, we don't have any opportunities to do anything with growth and development guidance appliances, and so it requires a change to the jaw structure. And that's done through a surgical process. Now, that surgical process used to be a major operation. It was somewhat invasive, and the teeth had to be wired together for many times 6 to 8 weeks following the surgery. Well, today, with the advancements in orthodontics and oral surgery, it gives us an opportunity to make that procedure much less invasive and virtually atraumatic, and the teeth don't have to be wired together any longer. So it's a very, very effective and efficient method of treatment that we've used many, many times on our adult patients.
Do you treat many adults?
Approximately 30% of our patient population are adults. Many years ago, patients lost their teeth prematurely at a young age, and that many times was due to the fact that they couldn't clean crowded and malposed teeth, or they had bad bite problems, which we're able to solve, and many times help people keep their teeth throughout their lifetime. And many times there are patients that wanted to have orthodontic treatment as an adolescent, but for whatever reason they just weren't able to have that done. And there are an awful lot of patients that value the importance and the aesthetics of a healthy and beautiful smile.
What types of braces are available today?
You know, when I had braces years ago, we used the old bands that fit like a ring on your finger. And today, with all of the advancements in technology, the braces are so much different and so much advanced. I've worked with a company, 3M Unitech, for many years to develop and assess and evaluate a self-ligating bracket, which we're currently using today. And it is a wonderful appliance. It is available in a ceramic bracket, which is tooth-colored. And we use a lot of Invisalign appliances to straighten and align relatively minor cases. And the ultimate in aesthetics is braces that go on the inside, actually on the tongue side of your teeth, called lingual braces. And in addition to that, the wires have changed dramatically. The wires are now made out of titanium instead of stainless steel, and those wires exert much less force on the teeth and makes the whole treatment process much faster and much more comfortable.
Who is a candidate for Invisalign?
You know, Invisalign is a great product, and we're happy to offer that type of appliance. There's some things that Invisalign is capable of doing, and there's some things that Invisalign just can't complete. I personally have worn Invisalign, as have many of the folks in our office, and many of their children have worn Invisalign, so it's a great product. There are many times cases that warrant much more comprehensive and much more complex treatment. And if that's the case, we'll sit down, we'll talk about the treatment options and offer what we think is the best treatment to achieve the result that they want.
Is there much discomfort with treatment?
Years ago, when you had braces, it was, I can speak from experience, it was pretty uncomfortable. The method in which we put braces on today is much easier, it's much shorter. We glue the braces directly to the teeth. And as a consequence of that, there's very little discomfort in braces today compared to years ago. And I can speak to that point from past experiences. I would venture to say that during the course of treatment, there may be very few times when it becomes necessary to take something like Tylenol or Advil over the counter. So I think it probably is a little bit of an adjustment period when the braces first go on. But I certainly wouldn't think it's a painful process today compared to years ago.
How often do patients come in for appointments?
Generally, during the beginning of treatment, the appointments are a little closer together, and near the end of treatment, they may also kind of cluster together. With all of the advancements in the technology and the appliances that we have today, many times we're able to stretch treatment appointments out to 10 to 12 weeks. Now, during the very first part of treatment, you may need to come in a little bit more often, and certainly near the end of treatment, those appointments will be a little closer together when we're fine-tuning the appliances and getting ready to take the braces off. The reason is that the wires that we use are made out of titanium, and it allows us to let those wires work a little longer than the previous stainless steel wires that we used years ago. So those treatment appointments can be stretched out many times to 10 to 12 weeks.